Welcome to Parents' Domain.
The two pink lines. Sarah stared at the small plastic stick in her trembling hand. Two pink lines. Unmistakable. A wave of pure, unadulterated joy washed over her, so potent it felt like a physical force, lifting her off the bathroom floor. She laughed, a giddy, breathless sound that echoed in the small space. They had done it. After a year of hoping, planning, and quiet disappointments, it had finally happened. She and her husband, Tom, were going to have a baby. She imagined telling Tom, pictured his face lighting up, the way he would sweep her into a hug and spin her around the kitchen. She thought of tiny shoes, of bedtime stories, of a little hand tucked into hers. The future, once a vague and distant concept, suddenly snapped into sharp, vibrant focus. But then, as quickly as the euphoria had arrived, a cold wave of anxiety crested over it, chilling her to the bone. It started as a small, nagging thought at the back of her mind, whisper of a worry. Insurance. The word landed with a thud in the pit of her stomach. Suddenly, the two pink lines on the plastic stick didn't just represent a baby. They represented a cascade of appointments, tests, procedures, and costs. A mountain of costs. The joy didn't disappear, but it was now tinged with a sharp, metallic taste of fear. This perfect private moment was already being invaded by the harsh realities of their life as freelancers in America. The reality check. That evening, the celebratory dinner Tom had planned felt more like a strategy session. The bottle of sparkling cider sat unopened on the table. Sarah and Tom were both freelance graphic designers, a life they loved for its freedom and creativity, but one that came with a constant low-level hum of financial insecurity. Their health insurance was a catastrophic plan, a safety net designed to protect them from a devastating accident, not to support the creation of a new life. It had a sky-high deductible and covered almost nothing in terms of routine care. Prenatal visits, ultrasounds, blood work, none of it was covered until they had spent thousands of dollars out of pocket. "We knew this would be a hurdle," Tom said, his voice a mixture of forced optimism and genuine concern. He reached across the table and took her hand. "But we'll figure it out. We always do." "But this is different, Tom," Sarah replied, her voice barely a whisper. "This isn't just about us anymore. How much does it even cost to have a baby? We have no idea. What if something goes wrong? What if I need special care? Our plan is basically useless for this." The conversation spiraled into a series of what-ifs, each one more terrifying than the last. They felt a profound sense of unpreparedness, a feeling that this beautiful, life-altering event was already being defined by deductibles and coverage limits. The dream was colliding with the reality of their balance sheet, and it was a jarring, uncomfortable impact. Just a quick reminder, have questions. Don't forget to visit our website at parentsdomain.com, the deep dive into insurance lingo. The next few days were a blur of research. Their apartment, usually filled with the creative chaos of their work, was transformed into a command center for navigating the American healthcare system. Their browser tabs were a labyrinth of acronyms and jargon: PPO, HMO, EPO, deductible, copayment, coinsurance, out-of-pocket maximum. It felt like trying to learn a new language, one in which a single misplaced word could cost them thousands of dollars. "Okay, so the deductible is what we pay before the insurance pays anything," Tom said, staring intently at his laptop screen. "But then there's coinsurance, which is a percentage we still have to pay after we meet the deductible. And that's different from the copay, which is a flat fee for a visit. And the out-of-pocket maximum is the absolute most we'd have to pay in a year," Sarah added. "But some things might not count towards it. And what's the difference between in-network and out-of-network again? They felt like they were drowning in a sea of fine print, each policy a dense, legalistic document designed to confuse rather than clarify. The more they read, the more they realized how little they knew and how vulnerable their financial situation was. Exploring the marketplace, they discovered the Health Insurance Marketplace, the online resource created by the Affordable Care Act, ACA. It was a beacon of hope in the fog of their confusion. They learned that the ACA had made it illegal for insurance companies to deny coverage for pre-existing conditions, which, to their relief, included pregnancy. But their hope was short-lived. They had missed the annual open enrollment period by a few weeks. A pop-up on the website informed them that they would have to wait until the following year to enroll in a new plan. They did, however, discover a loophole. Having a baby was considered a qualifying life event, which would grant them a special enrollment period. "So we can get a better plan after the baby is born?" Sarah asked, her voice laced with disbelief. "What are we supposed to do for the next 9 months? The most expensive part of this whole process." The irony was not lost on them. The system designed to help them was only accessible after they had already navigated the most perilous part of the journey on their own. A glimmer of hope, Medicaid and CHIP. Their research led them to another potential lifeline, Medicaid and the Children's Health Insurance Program, CHIP. These government programs provided free or low-cost health coverage to eligible low-income adults, children, and pregnant women. Filling out the application was a humbling experience, a detailed accounting of their fluctuating freelance income. They submitted the forms and waited, a new kind of anxiety settling in. A week later, a crisp, official-looking envelope arrived in the mail. Their application had been denied. Their income, while modest and unpredictable, was just high enough to disqualify them. The safety net they had hoped for was not there for them. They were in the donut hole of American healthcare. Too much income for government assistance, but not enough to comfortably afford private insurance. The first doctor's visit. With their insurance situation still unresolved, they decided to pay for their first prenatal visit out of pocket. The doctor was kind and reassuring, her calm demeanor a stark contrast to the turmoil in their minds. She confirmed the pregnancy, gave them a due date, and handed them a long list of recommended tests and screenings for the first trimester. Then came the moment they had been dreading. At the front desk, the receptionist slid a credit card machine towards them. The cost of that single visit, a routine checkup with a few basic blood tests, was over $500. Sarah watched Tom's hand tremble slightly as he inserted his card. It was a sobering, tangible reminder of the mountain of expenses that lay ahead. They walked out of the clinic in silence, the joy of their first doctor's visit overshadowed by the weight of the bill in Tom's pocket. The cost of a baby. That night, they created a spreadsheet. They plugged in the numbers they had found online. The average cost of a vaginal birth in their state, $18,865. The average cost of a C-section, $26. The estimated cost of prenatal care without insurance, around $2,000. And the potential costs of unforeseen complications. The numbers on the screen were staggering, a testament to the exorbitant cost of healthcare in the United States. "We could sell the car," Tom said quietly, staring at the total at the bottom of the spreadsheet. "And we can forget about that trip we were saving for," Sarah added. "And we'll have to take on every project that comes our way, no matter how grueling." The conversation was grim, a stark accounting of the sacrifices they would have to make. The joy of starting a family was now inextricably linked to a sense of financial dread, a stroke of luck. Just as they were starting to feel truly overwhelmed, A lifeline appeared. Tom, who had been quietly sending out his resume for months, got a call for an interview. It was for a senior designer position at a large tech company, a stable, full-time job with a generous benefits package. He aced the interview, and a week later, he had an offer. The relief was immense, a physical sensation that washed over them, releasing the tension they had been carrying for weeks. They celebrated that night, and this time, the sparkling cider was opened. It wasn't just a job, it was a solution. It was health insurance. Just a quick reminder, have questions. Don't forget to visit our website at parentsdomain.com. Choosing a plan. With Tom's new job came a new set of decisions. They were presented with several health insurance options, each with its own set of trade-offs. They spent hours poring over the summary of benefits and coverage documents, comparing monthly premiums, deductibles, and out-of-pocket maximums. They debated the merits of a PPO, which offered more flexibility in choosing doctors, versus an HMO, which had lower premiums but a more restrictive network. They ultimately chose a PPO plan with a moderate deductible. It was more expensive per month, but it gave them the peace of mind of knowing they could choose the best doctors and hospitals for Sarah and the baby. For the first time in weeks, they felt a sense of control over their situation. The first ultrasound. A few weeks later, Sarah lay on an examination table, a cool gel spread across her belly. The room was dark, the only light coming from the ultrasound screen. And then, there it was. A tiny, flickering heartbeat, a rhythmic pulse of life in the center of the screen. Tears streamed down Sarah's face, and she squeezed Tom's hand. All the stress, all the worry, all the spreadsheets and phone calls and confusing jargon, it all melted away in that moment. All that mattered was the tiny life growing inside of her. They were going to be parents. They left the clinic that day with a renewed sense of joy and purpose, the black and white image of their baby, a precious reminder of what was truly important. Navigating the system. Even with good insurance, navigating the healthcare system was a challenge. They quickly learned that having coverage didn't mean everything was simple. There were pre-authorizations to obtain, referrals to secure, and a mountain of paperwork to keep track of. One afternoon, Sarah spent over an hour on the phone with the insurance company, trying to understand why a claim for a routine blood test had been denied. She was transferred 3 times, put on hold for what felt like an eternity, and given a series of confusing, contradictory explanations. It was a frustrating, maddening experience, a reminder that even with a safety net, the system was still a bureaucratic maze. Just a quick reminder, have questions. Don't forget to visit our website at parentsdomain.com, the glucose test. At 28 weeks, Sarah had to take the dreaded glucose test to screen for gestational diabetes. She sat in the waiting room, the sickly sweet taste of the sugary drink still lingering in her mouth, her anxiety mounting with each passing minute. An hour later, she was called back for a blood draw. The wait for the results was agonizing, another reminder of the many hurdles and potential complications of pregnancy. When the call came a few days later with the news that her results were normal, the relief was palpable. The birth plan. As the due date approached, they hired a doula, a woman named Maria, who became their guide and advocate. She helped them create a birth plan, a document that outlined their preferences for labor and delivery. They wanted a natural birth with as few medical interventions as possible, but they were also open to the idea that things might not go as planned. Maria empowered them, giving them the language and the confidence to communicate their wishes to the hospital staff. The nesting instinct. Sarah was in full nesting mode. The spare room was transformed into a nursery, painted a soft, calming shade of green. Tom assembled the crib, his brow furrowed in concentration as he deciphered the instructions. Sarah washed and folded tiny clothes, marveling at how small they were. Every task was an act of love, a way of creating a safe and welcoming world for their little one. The real deal. A few days later, the contractions started again. This time, there was no doubt. They were stronger, more regular, and more intense. This was it, the real diesel. They grabbed their hospital bags, which had been packed and waiting by the door for weeks, and headed to the hospital, a sense of calm determination settling over them. A beautiful birth. After a long and intense labor, their beautiful baby girl, Lily, was born. She was perfect, with a full head of dark hair and a cry that filled the room. Holding her in their arms for the first time was a moment of pure, unadulterated magic, a feeling so profound it defied description. All the struggles of the past 9 months faded into insignificance. All that mattered was this tiny, perfect human being they had created. Just a quick reminder, have questions? Don't forget to visit our website at parentsdomain.com. The hospital bill. A few weeks after they brought Lily home, the thick envelopes started to arrive. The hospital bills. The total cost was astronomical, a number that would have been financially ruinous for them just a few months earlier. But as they opened the explanation of benefits from their insurance company, they saw that the vast majority of the costs had been covered. Their out-of-pocket expenses were manageable, a fraction of the total. They were a testament to the power of good health insurance, the difference between starting their new life with a mountain of debt and starting it with a sense of security. The postpartum period. The first few months with a newborn were a whirlwind of sleepless nights, endless diaper changes, and an overwhelming, all-consuming love. It was also a period of immense emotional upheaval for Sarah. She experienced a bout of postpartum anxiety, a constant low-level hum of worry that made it hard to sleep, even when the baby was sleeping. Thanks to their insurance, which covered mental health services, she was able to find a therapist who specialized in postpartum issues. The therapy, combined with the support of Tom and her family, helped her navigate that difficult period. It was another reminder of how crucial their insurance had been, not just for the physical health of their family, but for their mental and emotional well-being as well. A new chapter. As they settled into their new life as a family of 3, Sarah and Tom often reflected on their journey. They had learned so much about the importance of health insurance, the complexities of the U.S. healthcare system, and the resilience they never knew they had. They had faced down their fears, navigated a bureaucratic maze, and come out the other side stronger and more united than ever. One evening, as they sat on the couch, a sleeping Lily nestled between them, Tom turned to Sarah. "We did it," he said, his voice filled with a quiet sense of awe. "We did," she replied, stroking Lily's soft hair. "It wasn't easy, but we did it." Their beautiful daughter was a testament to their love, their perseverance, and their willingness to fight for the future they had dreamed of. She was worth every spreadsheet, every phone call, every moment of anxiety. She was their new chapter, and they couldn't wait to see what the future held.